what it seems. Things won't turn out perfectly when you want them to. And there is one thing you can do.
In conjunction with this book, can you talk about your research in perimenopausal and postmenopausal women? Let's talk about that and how this relates to bringing Athena to life.
Yes, hormone health is vital to women's health. And I did a medical student research fellowship at the National Institutes of Health in Bethesda, Maryland. And that formed a very strong foundation for me as it relates to hormone assessments and how vital hormonal factors are, not just in the end organs where they do their work, but also in the brain, and how they were cofactors in many pathways related to pain processing, immune factors, cardiovascular disease, connective tissue disease, respiratory disorders such as asthma, COPD. If women have any of these conditions, they need to know their hormone status. They need to know what's going on with the 5 most important hormones. That's estrogen, progesterone, testosterone, DHEA, and cortisol, the stress hormone. And my research has confirmed that hormone balance leads to many benefits, not just as it relates to mood and pain levels and quality of life and weight, which are symptoms that a lot of my patients present, but as it relates to cardiovascular health, brain health, and our protection against age-related conditions such as dementia and osteoporosis. Traditional medicine taught me to use synthetic hormones as it relates to women's needs in perimenopause and menopause. My own observations revealed that this might not be the best path for women. And then we had the landmark study of the Women's Health Initiative, which asked the question, is the use of Premarin and Prempro safe for women? And is it beneficial as it relates to protection against heart attacks and strokes, as it was claimed? Well, the results of the Women's Health Initiative were profound. And both arms of the study, the Prempro arm and the Premarin arm of the study, were stopped early because of the high rates of bad things happening in women being treated with these hormones. The conclusions showed there was an increase in breast cancer risk, in heart attacks, strokes, blood clots, and dementia in women being treated with these hormone preparations. I felt there was a better way, and I call this method the hormone restoration model of care. It's where we are measuring the 5 hormones that I mentioned earlier in women as they go through the perimenopausal transition, which can begin in the late 30s. Menopause can also happen surgically to women in their 30s or 40s if they have a hysterectomy and they have their ovaries removed. Natural menopause tends to occur around age 50. So in the hormone restoration model of care, the hormone levels are measured and women are supplemented with plant-derived, these are botanical sources of hormones, natural hormones, as needed as they go through the transition. And I enrolled women between the ages of 35 and 70, because again, one of the myths of medicine is that after menopause, women aren't candidates for hormone therapy. And I have found that hormone levels are vital as it relates to protection against some of the age-related diseases that happen in the postmenopause. And this is why I was adamant about enrolling women up to age 70 in this study. And we followed the women for 3 years using the hormone restoration model of care and looking at outcomes as it related to their blood pressure, their triglycerides, their depression scores, their anxiety scores, their stress scores, their pain scores, looking at immune signaling factors, which are so important as it relates to risk of COVID infection. And we found beneficial effects in all of these pathways, especially on biomarkers that are linked to cardiovascular disease risk. That's the leading cause of death and disability in women worldwide. So I have an entire chapter dedicated to hormone health, as well as many case studies with examples of women from their 20s all the way to their 80s and their hormone levels and what I did about it and what I prescribed. Also, I want to say that the hormones that I used in the study, many have now become available over the counter. And so women truly can take control of their health as it relates to hormone balance, which is vital in total health.
That's beautiful. So is there a place that they can go for testing so they can actually test exactly what they're going to need?
Yes, the lab that I recommend is ZRT Lab. That's Z like zebra, R like reindeer, T like tiger, okay? ZRT Lab. And they're located in Beaverton, Oregon. They are equipped to receive and process samples from women all over the world. So you can simply go to the website zrtlab.com or salivatest.com and find out how to get your hormone test kit. They will mail it to your house. You collect the sample, you mail it to them, and you get the results.
Beautiful. And then from the results, how do they get the exact knowledge of what they need? Because most medical doctors are not going to operate that way.
Well, like I said, most of these botanical agents are available without a prescription now. And so their guide is the Gospel of Women's Health. I have many, many case studies where I show hormone levels and then what the patient received.